This segment shows you how to carry out your transfers while respecting your movement restrictions. Before going any further, we'd like to remind you of the movements to avoid after your surgery. First, do not hold your legs together. Second, avoid crossing your legs. Third, do not bend your hips more than 90 degrees, the angle formed between your chest and thighs. Simply put, your hands should not extend beyond your knees. These 3 movement restrictions are applied throughout the following videos. When it comes to transferring to a chair, choose the one that is high enough to be mindful of your movement restrictions and that ensures that your hips are always at knee height or slightly higher when seated. You can add a cushion to raise yourself if necessary. To sit down, approach the chair until the back of your legs are touching the edge of the seat. Then extend the operated leg forward, looking ahead with your back as straight as possible, and reach out behind you for the armrests. Use your arms and non-operated leg to gently sit yourself down. Do not use the walker to stand up because you'll be leaning too far forward and it's not a stable enough surface to lean on. Instead, move your operated leg forward and slide yourself to the edge of the chair. Keep your back straight and your gaze forward. Then use the armrests and your non-operated leg to gently raise yourself to a standing position. Then place your hands on the walker. For getting into bed, swing your non-operated leg onto the bed first to help maintain hip stability while you are healing. Sit down as demonstrated earlier. Keep in mind that in the case shown, the left hip has been operated on, so the right leg goes onto the bed first. You can sleep on your back as shown on the screen. You can also lie on the operated side, which will be shown at the end of the slide. Both positions help maintain the alignment of the operated leg. Avoid lying on your non-operated side because that places the operated leg above your body, leaving it unsupported. This puts you at risk of having your legs crossed, which is a movement restriction. Always have a thick pillow between your thighs while sleeping to keep your legs apart. We recommend 2 approaches to getting out of bed. The first method is to slowly move the operated leg off the bed first. To do this, you need to swing the operated leg out to the side of the bed. You can use your arms to sit on the edge of the bed and stand up gently. The second method of getting out of bed is to turn on your side with a pillow between your legs and to sit up all at once using your arms. This concludes the segment on transfers. The next segment provides tips on getting dressed.